Pseudotumor cerebri, or known also as idiopathic intracranial hypertension, it goes by numerous names, but it's an elevation of the pressure in the skull from some reason that we are not completely privy to. Usually it's not because of some mass or anything like that. What it manifests as typically are headaches, sometimes nausea and vomiting, and most importantly, visual difficulties. Some common symptoms are most notably headaches and visual changes. The ultimate sequelae sometimes can be blindness if left untreated. The biggest risk factor typically is having a higher BMI or being somewhat overweight. Pseudotumor cerebri is typically diagnosed in a very roundabout way most of the time. A lot of the times the symptoms are somewhat insidious or they come about very slowly. Usually the patients complain of headaches and visual changes. And eventually a clinician will order imaging of the brain, and that will lead us down to a diagnosis of pseudotumor cerebri. Classically, we treated people with diversion of CSF, or VP shunt as you would call it, where we insert a catheter into the fluid-filled spaces in the brain to help relieve the pressure, and that drains down into the stomach. We are looking into other methods of treating folks with pseudotumor cerebri without having to do an open brain surgery on them. What we do now is look into the blood vessels in the brain to see if that is a potential cause for pseudotumor cerebri. Most notably, narrowing of the big veins in the brain. That's the area where the fluid in the brain is absorbed, and if that area is narrow, then obviously there's a buildup of fluid. Now we can sometimes place stents in the veins in the brain to help alleviate that pressure from the pseudotumor. So we at Tulane Neurosciences are well versed in all areas of diagnosis, management, and treatment of pseudotumor cerebri. So if you have any issues with that, please come see us.